All right, so for Module 9, there are a lot of chapters included in Module 9, and that should be a good indicator to you that we are not going to cover all of the information in each of those chapters. So Chapter 19 is on cranial nerves. We're going to keep it really basic with cranial nerves, so this should be a quick little lecture. Chapter 20 is on the brain stem, and again, we're going to go very basically over the anatomy and function of the brain stem. And when you look at the learning modules, you'll see the learning objectives, there are not a lot of objectives for each one of these. So it should be pretty simple. Chapter 21 is on the visual system, and chapter 22 is on the vestibular system. We will go a little more in depth, but not to the depth that the textbook goes. So hopefully that'll feel good. And chapter 23 is specifically on examination of dizziness. And we are not going to really go into chapter 23, except to the extent there is an assignment where you look at the dizziness handicap inventory, which is an outcome tool that's used in the clinic, and use the information that we talked about just to engage with one of the items on the dizziness handicap inventory. So it should be pretty straightforward, and of course we'll have office hours on Thursday night, so if you have questions we can discuss it, but hopefully it'll be an easy module. So with the cranial nerves, the learning objectives for this are just to list the cranial nerves and their basic functions. So there are 12 cranial nerves, and there's a table in the book, figure 19.2, that lists the cranial nerves, and really that is all the information that you will need to know for this learning objective. So if I asked you what cranial nerve 11, the spinal accessory nerve, does, you would say that it's a motor nerve. It elevates the shoulders and turns the head. And as we learned in kinesiology last spring, it innervates the upper trapezius and the sternocleidomastoid. So those are those head turning muscles. So it should be pretty easy. So cranial nerves, they exchange information between the peripheral and the central nervous system. So unlike the spinal nerves, which tend to have one function, they're either sensory or they're motor, or they're autonomic. The cranial nerves can have sensory or motor or autonomic functions, or be mixed and contain some of each. So we'll just briefly go over them and we'll state whether they're mixed. And in the chart, in figure 19.2 in the book, it's color-coded. Isn't that nice? Between motor, sensory, and mixed. So cranial nerves differ from spinal nerves in the fact that they are not specialized. The spinal nerves are specialized either motor or sensory or autonomic. Cranial nerves can be mixed. So this is figure 19.1 from the book, and I like it because, well, again, it's color-coded. The motor functions are in red there, and it shows like a representation of the axon in red. The sensory functions are in blue, and then the autonomic functions are listed there as well. So we also have a couple of the cranial nerves that deal with special senses, like vision, smell, and hearing. So we will go a little bit into the visual system. We will really not be talking about smell at all, because that is not something that we treat people for in physical therapy. Although you might meet someone who, because of a brain injury of some sort, a CVA or a traumatic brain injury, has lost their sense of smell. There's no treatment for that, but there you go. You'll know they've lost that because of changes to the cranial nerve. So those particular sensory nerves, some of them we will discuss, some of them we will not. Of course, we're not going to discuss anything having to do with gustation, which is taste, because, again, we don't do therapy on taste. So the cranial nerves basically have 4 functions. They supply motor innervation to the muscles of the face, eyes, tongue, jaw, and those 2 neck muscles, the upper trapezius and the sternocleidomastoid. So you can sort of think of the cranial nerves, their motor function. They provide motor function for the head, just like the motor neurons provide motor function for the rest of the body. The cranial nerves also transmit somatosensory information from the skin and muscles of the face and from the temporomandibular joint. So again, it's analogous to the somatosensory system of the body, but it's for the face. Okay? So the cranial nerves are sort of like a mini peripheral nervous system for the head and face. The cranial nerves, some of the cranial nerves also transmit that special sensory information, visual, auditory, vestibular, gustatory, olfactory, and visceral sensations. So some of those we deal with in a PT setting. Some of them, obviously, like gustatory, we do not. They also, cranial nerves, some of them also have an autonomic function, providing parasympathetic regulation of pupil size, curvature of the lens of the eye, heart rate, blood pressure, breathing, and digestion. So lots of stuff going on in the cranial nerves. And I guess that's one of the things that makes them interesting. The neurologists will often do their different cranial nerve tests, and these are discussed in the text. You won't be responsible for knowing them, but they will test different things to test cranial nerve function, like they'll have you stick your tongue out, and whether it goes straight or to one side or the other can be indicative of lesions in certain areas. So there are different cranial nerve testing. If you wanted to test like the olfactory nerve, which is cranial nerve 1, does smell, you would have somebody smell familiar scents and be able to identify them. So there are cranial nerve tests which we will not talk about, except to the extent that I just did. So the olfactory nerve, cranial nerve 1, is sensory, obviously. The sense of smell is dependent on olfactory nerve function. But a lot of the information that we attribute to taste is actually olfactory in origin, because the information from the taste buds is limited to chemoreceptors for salty, sweet, sour, and umami, and bitter. And umami is also known as savory. So a lot of the individual tastes that we experience have to do with the olfactory nerve. Pretty interesting, I think. But really, as we're going through this hopefully short lecture, you can look at the chart on figure 19.2 on cranial nerves, and that's all you'll need to know. That chart has one section, that connection to the brain, and you really kind of don't need to know much about that either, or I'm not going to quiz you on it. But there you go. Cranial nerve 2 is the optic nerve. The optic nerve clearly is sensory, and we will talk about this more in chapter 21 when we talk about the vision system. The retina is the inner layer of the posterior eye, and light striking the retina is converted to neural signals or encoded by those photosensitive cells, and the optic nerve sends visual signals to the midbrain for reflexive response to the pupil, awareness of light and dark, and orienting the head and eyes. So there are some of the other cranial nerves that are involved in eye movements. Actually, quite a few of our cranial nerves are dedicated to eye movements. So vision or eye movement. So it's kind of interesting that so much is dedicated to vision. So cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens, are primarily motor nerves that work on moving the eye and controlling the constriction of the pupil. So 3 cranial nerves dedicated just to that, and then another one for vision. So I think that sort of gives you an indication how important vision is in terms of a survival aspect of it. So cranial nerve 5 is the trigeminal nerve. It's mixed. It has both motor and sensory fibers. So that's where it's different from spinal nerves. Sensory fibers transmit sensory information from the face and the temporomandibular joint. And the motor fibers control the muscles of mastication. So the trigeminal nerve has 3 branches. You don't need to know the separate branches: ophthalmic, maxillary, and mandibular. But they're the trigeminal nerve, that's sensory and motor. The facial nerve is largely motor, although it does convey some sensory information as well. It innervates the muscles of facial expression and a lot of the glands in the head, like the tear ducts and the salivary glands. It also conveys sensory information from the posterior ear canal and taste from the anterior tongue. So that's another one of those mixed ones. But all of those things, if you think about survival and what we need to have, so as human beings, we need other human beings in order to survive. So the muscles of facial expression are important, so we can communicate with each other on a nonverbal basis. One of the things after a brain injury, a CVA or TBI that affects facial expression, that can really affect a person's relationships. So it's a survival thing, kind of interesting. Facial nerve also carries efferent signals for the corneal reflex, and they're all taken to the brainstem and processed in the pons and medulla and the upper spinal cord. So mixed facial, motor, and sensory. The vestibulocochlear nerve is sensory. So it's a sensory nerve. It has two distinct branches. The vestibular branch, it transmits information related to head position and head movement. Really a big player in balance. So we'll talk more about that in chapter 22 when we talk specifically about the vestibular system. The cochlear branch transmits information related to hearing. So the peripheral receptors for these functions are located in the inner ear, also known as the labyrinth. And it consists of the cochlea, which is the snail part, that's dedicated to hearing, and the vestibular apparatus, which is the balance part. So we'll talk more about that in chapter 22. The cranial nerve 9 is a mixed nerve, glossopharyngeal nerve, contains both sensory and motor fibers. The sensory fibers give us somatosensation from the soft palate and pharynx and information from taste receptors in the posterior tongue. And the motor component innervates pharyngeal muscles and the parotid salivary gland. As you can tell, this one is pretty important in swallowing. So eating and swallowing. A lot of times people after neurological injuries or degenerative neurological processes experience difficulties with swallowing or salivation, and normally they are seeing a speech pathologist for this, but it's very involved in a lot of people's rehab from their CVA or other type of injury. The vagus nerve is cranial nerve 10, and it's really, there's a lot, the vagus nerve covers a lot of things. It's afferent and efferent innervation of the larynx, the pharynx, and the viscera. So lots of connections allow the vagus nerve to decrease heart rate, constrict the bronchi, they affect speech production, and they increase digestive activity. They test the motor function of the vagus nerve by eliciting the gag reflex. So if you have an absent gag reflex, you might have some effects on your vagus nerve. Cranial nerve 11, the spinal accessory nerve, we talked about this in kinesiology when we were talking about the innervation for the trapezius and the sternocleidomastoid. It's obviously a motor nerve, and it originates in the spinal accessory nucleus in the upper cervical cord. And so it actually originates outside the skull, but it goes up into the foramen magnum and then goes out through the jugular foramen to innervate those two muscles. So it's kind of interesting, even though it's included as one of the cranial nerves, it's closer to being a spinal nerve than all the other cranial nerves. But those head turning motions are often linked with vestibular ocular reflex and vision tracking, that sort of thing. And so I think that's the main reason why they're included in the cranial nerves. Cranial nerve 12, last one, is the hypoglossal nerve, and it provides Innervation to intrinsic and extrinsic muscles of the ipsilateral tongue. So one side of it innervates the same side of the tongue that it's on, and the other side innervates the other side of the tongue. So it's controlling tongue motions. So the glossopharyngeal nerve is more swallowing and taste, and the hypoglossal nerve is tongue motions.